Our key policies and recommendations are in this brochure, in the first half, on your left side, as you look at the document. I will summarize and talk about the reasoning behind that rather than reading these out to you. And the first talks about improving the quality of indoor-outdoor air, both ambient and ground levels, particularly in Bayview Hunters Point. Some of my colleagues in the past, we've done research ourselves, and in '98 we did air studies, and that the air in Bayview Hunters Point compared to here is 3 times dirtier than in Bayview Hunters Point. For example, at George Washington Carver Elementary School in '98, the asthma rates for babies in the first grade, 55% of the first graders were asthmatic as defined by a physician. In 2006, 85% of the babies are asthmatic. It hasn't gotten better, it's gotten worse. Next, we need an analysis. So often research is done and it stays on somebody's shelf. The issue is, how do we make a change and impact the community? Is it safe for the baby to play outside if the air is dirty? Hospitalization rates for the children in Bayview Hunters Point are 4 times higher than the state average in the state of California. For our senior citizens, should they be outside? That's one of the reasons what we were talking about in terms of air quality. Also, we forget, and that's why we have this picture on the top here, household chemicals for indoor air quality. For example, some folks would be cleaning. My mother used to use bleach all the time, everywhere. Everywhere, still do. But when you mix ammonia with bleach, you release chlorine. And it does get the floors clean, and it gets clean, but you're taking in chlorine gas, which is the basic element of mustard gas in World War I. You're killing yourself. A little bit, think of it as a cumulative effect. Think of it as you put a penny on a baby's chest, on a newborn, no problem. But you put 50 pennies, start to weigh. Yeah, those pennies times 365, times 5 years, that baby's chest will be indented and sunk in. It's an accumulative effect that we need to look at. So we were saying we need to do science correctly. As Ernie and I, we were talking about what the methodology and how it should be impacted, and what we need to look at. And that indoor air, we wanted an educational program because you need a healthy respect for chemicals and understand the usage of chemicals. That a chemical is like a knife. You could use it to slice a piece of bread, or you could use it also to stab somebody. Unfortunately, in our communities, we are getting the adverse effect of it. And finally, we need a collaboration of the different reporting agencies that address air quality. Some of the air board quality is more political than scientific. We need that to stop, and we need this to be addressed. And we need the cooperation of each other. Sometimes they have their turfs and one don't talk to the other. Sometimes you can have a cure sitting on a shelf and nobody opened the book to even look at it, how to implement it. That has to stop. We are too adversely being affected. And you later will have a discussion on morbidity and mortality rates. We are dying too soon. The average life expectancy for an African male in Bayview Hunters Point is 56 years old. Average life expectancy for a white male in the city, county, San Francisco is 78. And I don't see the generations improving. So as we looked at the environment in this and summarizing this, what can we do? Air affects all of us by diligently monitoring, looking at what's in it, and how should we act accordingly with the knowledge that we have, and not just leave it on a shelf and say we did it, but how can it impact and improve our lives? With a little bit of knowledge and implementation and cooperation, we think we can make a change and improve the quality of life for our community.